I'm very excited to be here to talk about sun protection and skin cancer awareness. So let's go ahead and get started with some information on skin cancer. Skin cancer is very common, actually, in the U.S. More than 5 million skin cancers are diagnosed annually in the U.S., and melanoma incidence rates have been increasing over the last 30 years. It's so prominent that 1 in 5 Americans will develop some form of skin cancer in their lifetime. So if we look around us, that would be statistically 1 in 5 of us either has had or will have a skin cancer at some time. So this is a substantial public health problem, and it's gotten worse over the past 50 years. Melanoma incidence has been on the rise. It's increased 15-fold, and the numbers work out such that nearly every hour an American dies from melanoma. So in my practice in Orange, I have a lot of patients that come in and say, well, I was the generation that laid out and tried to tan until I burned, or laid in the sun with baby oil and iodine, trying to get as dark as I could. And that really is most of my patients. I can't tell you how many times every day I hear one of my patients say that. So, so it's a substantial problem. And melanoma affects all of us. You know, I will say that patients with more fair skin types are more likely to get skin cancer, but I do have patients that have darker skin types that do have skin cancer as well. So they're less likely to get it, but it is possible. They still are at risk, and in fact, usually when it's found, it can often be found at a later stage and be more advanced because patients with more melanin in their skin sometimes aren't on the lookout for skin cancer like patients with more fair skin. The take-home message that I want to send today is that melanoma is curable if we catch it early. And so my hope is that when we leave today, we'll all have a better understanding of how to recognize skin cancer, and in particular melanoma, which is the most deadly form of skin cancer. So having one blistering sunburn increases your lifetime risk of developing melanoma. And your chances of developing a sunburn are greatest between 10 a.m. and 2 p.m. So what I tell my patients is when your shadow is shorter than you are, that's when you're most at risk of getting a sunburn. That's when the sun's rays are the strongest. Not only that, sun damage can also lead to premature skin aging and wrinkles. So that would be another motivating factor to protect your skin from the sun. Now, a lot of my patients who come in with skin cancer or pre-cancer will say, well, how do I have this? I don't go in the sun at all. I haven't been in the sun in a long time. And what I tell them is, it's not the sun that you got last week or last month or even last year. It's more of the lifetime of sun exposure that caused your risk. And the studies have shown that most of the sun we get is in our youth, so before the age of 18. So how many of us have had a sunburn? So, so almost everybody in the room. So, so you're all familiar with the process, and so the sun exposure that you got a long time ago in your youth could be causing skin cancer now, years and years later. Okay. So I want to talk to you about the various types of skin cancer, but before I get into it, I wanted to sort of show you the different parts of the skin. And let me see if my mouse works here. Okay, so the top layer of the skin is called the epidermis, and then underneath the epidermis is the dermis. And The three most common types of skin cancer arise in the epidermis, which is the top layer of the skin. That's the skin that's most susceptible to sun damage and sunburn. And within the epidermis, we have squamous cells, we have basal cells, and we have melanocytes. And the melanocytes are responsible for making melanin, or giving us the pigment in our skin. And the melanocytes lead to melanoma. The basal cells lead to basal cell carcinoma, and the squamous cells lead to squamous cell carcinoma. So the most common type of skin cancer is basal cell carcinoma. And actually, it's the most common type of cancer in general in the United States. So how many of us have heard of basal cell carcinoma? Okay, so that's good. So you'll know what I'm talking about. The nice thing about basal cell carcinoma is that it's very slowly growing and slowly evolving. So it has a very low chance of spreading to other parts of the body. So when I have to diagnose a patient with basal cell, I always say that's a great one to have because we can cure it. And the basal cell is caused, like I said earlier, by a large amount of total accumulated lifetime sun exposure. And then we have squamous cell carcinoma, which is the second most common type of skin cancer. And similarly to basal cell, squamous cell carcinoma is 100% curable if we find it and treat it early. That being said, it does have a little higher chance of spreading to the lymph nodes if it is not found and treated early, especially in places that are higher risk, like the ear and the lip. So anytime someone comes in, I'll check the ears, and I'll have patients say, wait, you can get skin cancer on your ears? And I say, yes, of course you can, especially in our men who wear their hair short. Their ears are very exposed, and that's a place where we don't remember to put sunscreen, or oftentimes if you're just wearing a baseball cap, your ears won't be protected. So I always check the ears when patients come in. And then we have the most deadly type of skin cancer, which is called melanoma. And how many of us have heard of melanoma? Okay, good. You guys are well versed in skin cancer. So melanoma is more deadly than the other two common types of skin cancer. And the reason is that it has a higher chance of spreading throughout the body. So when someone has a melanoma, I'm always on the lookout for how advanced it is. The more advanced the melanoma is, the higher the chance we have of finding it either in a lymph node or finding it later, because it can spread either through the lymphatics or the bloodstream. So melanoma is dangerous. On this slide I wrote, if you notice a mole on your body that has changed or has any of the ABCDE features, which I'm going to explain what that is, it is important to have it evaluated by a physician. So I wanted to show you some examples of melanoma that I've had in my patients in my practice. Here's a lady with a melanoma on the thigh, and you can see it's a large, dark brown spot with an irregular border. Here's another melanoma on the trunk that looks like it's very dark, it's raised, it has two different colors in it. This is a gentleman that had this large irregular patch on his cheek, and you can see it's black in the center, it's pink on the side, it's brown. It's got an irregular border, meaning I can't just draw a nice round circle around it. So this was a melanoma. This is one of my patients who had a melanoma on his back. What do you guys notice about this one on the back? Other than that purple is my marker. Yeah. Other than the purple, what do you notice about it? It's raised. irregular color, right? So it's black and pink. It might not be showing very well with the light in here. Here are some other examples of melanoma. I show this one, which is on the bottom of the foot. So anytime a patient comes into my office, I always will look at the feet and between the toes, because you can also get skin cancer on the feet. And that's not a place that we check very often at all. So, so this is what I promised to explain. We call it the ABCDEs of melanoma. A stands for asymmetry. So if you can draw a line down the middle and it looks the same on both sides, that's very good. If it's not symmetrical, that's a worse feature. So on the left-hand side, those are normal moles. On the right-hand side, those are abnormal moles or melanoma. B is border irregularity. So like I said, if you can draw a nice round circle around it, that's a good sign. If you have to draw like a jagged line or a weird shape to get around the lesion, that's not a very good sign. C is variation in color. So if it has more than one shade of brown, or if it's brown and black, brown and pink, that would be more worrisome than if it had a nice uniform color all the way throughout. D is for diameter. So the rule of thumb is anything bigger than a pencil eraser, we have to look a little more carefully at to make sure. And then E is evolution, so change over time. So those are the ABCDEs of melanoma. This is a lady who came to me for the spot on her back. She couldn't really quite see it herself, but her husband had been telling her to come and get it checked out. And what do you notice about this spot? It's irregular. What else? Dark, large size. Exactly. It's like about 2 centimeters in size. What about the border? Yeah, also irregular. So it's kind of elongated. And so this turned out to be a melanoma. And this was a more advanced melanoma. And the way we judge if melanoma is advanced is by how thick it is. So the thicker the melanoma, the more advanced it is. And so if in this case it reached beyond the threshold of thickness that we look at for staging. And so this lady had to go and have what we call a sentinel lymph node biopsy at the time that they took out the melanoma. So they took out the melanoma and they took out a few lymph nodes from under the arm at the same time, and they tested the lymph nodes. In her case, she's doing great. The lymph nodes were clear, and she's got a really long scar where the melanoma was removed, but she is cancer-free. This is a lady that I actually diagnosed with melanoma about 3 weeks ago. What do you notice about the location? It's behind the knee, right? How many of us can get back there and really look? So she didn't know she had this. Ignore my purple marker around it. We mark them before we take pictures. But if you notice, it's kind of brown and black on one side, and then it turns white for some reason. So this is a melanoma, and hers was not so thick that it required a lymph node biopsy. So actually, just a few days ago, I went back and took a safety margin of normal appearing skin out around it. So when we take these out, we have to take out the cancer, but we also have to get around it with a normal appearing skin. We call it a safety margin. And with melanoma, the safety margin is much wider than when we take out a basal cell carcinoma or a squamous cell carcinoma. And that's because melanoma is more dangerous and has more microscopic irregular roots. This is another patient that I had a few years ago with melanoma. On this one, it's just a large brown patch, brownish blackish patch on the back, and this was a very superficial melanoma. But look at his skin. What do you guys notice about his skin? really freckled. He's had a lot of sunburns, and look how leathery the back of his neck is. This is someone who's worked outdoors all his life. So I have a lot of patients that come in that have worked construction their whole life, or I've had patients that are roofers or did pool maintenance, or all of these outdoor professions where they've had a lot of sun exposure. So it's easier to find a skin cancer if you are doing self-exams. So what that means is just looking at your body front and back with a full-length mirror, raising your arms, checking your sides, looking at your forearms, bending your elbows, looking at your palms, looking under your arms. With a hand mirror, looking at the back of your neck, your genital area. I always ask my patients, do you have any new lumps or bumps? I actually had a lady back in either November or December with a melanoma in the anal area, which it's very uncommon, very unusual, but she just kind of dismissed it and thought it was a hemorrhoid. So if you have lumps or bumps that are new or changing, you want to ask your doctor to look at it for you, because oftentimes we can't check for ourselves. And then your scalp. So why would people get melanoma on their scalp, or not even just melanoma, any skin cancer? Yeah, just sun exposure. So especially if our hair is thinning, or like women who wear their part on one side, like their whole life, their part has been on one side. I'll examine the scalp and I'll see the rest of their scalp is white, but the part is tan. So, our scalps get sun too, and I diagnose a lot of skin cancer on the scalp. And then the backs of your legs, feet, including the spaces between your toes and the soles of your feet. So I just wanted to go over some of the risk factors, and a lot of these you know, and we've talked about, right? So fair skin, freckling, red hair, skin types that always burn and never tan are at higher risk for getting skin cancer. So you see ultraviolet light is a big one. And then other environmental exposures like tanning beds, radiation, some chemicals, human papillomavirus, and cigarette smoking, chronic non-healing wounds, and organ transplantation. Why would organ transplantation put you at higher risk for skin cancer? Depression. Exactly, very smart. So when you get an organ transplant, you have to take medications that suppress your immune system so that you don't reject the donor organ. And when your immune system is suppressed, you have a higher risk of getting skin cancer, because a lot of times it's our own body that catches these abnormal cells and gets rid of them before they turn into skin cancer. For melanoma, the risk factors a lot of them are similar, but I added in here a family history of abnormal moles, previous sunburn, living near the equator, having multiple moles, and having had one or more melanomas before puts you at risk for developing another one. So just a few words about ultraviolet light. We have two types of UV light that matter to us. One is UVA and the other is UVB. UVA, I use a mnemonic, A for aging. So A can prematurely age your skin and can pass through window glass. UVB, the mnemonic is B for burn. So UVB causes sunburn and is blocked by a window glass. Another thing about UV light is that the sun can get through even on a cloudy day. UV light can pass through and penetrate the skin. And now UV light has been determined as a known carcinogen, meaning a cancer-causing substance. which means there is no safe way to tan. So every time you tan, you damage your skin, and this builds up and speeds up the aging of our skin and increases our risk for skin cancer. So you've probably heard a lot about the SPF. SPF stands for sun protection factor, and the way this SPF is determined is by comparing the amount of ultraviolet light that is required to cause a burn in skin that was protected as opposed to skin that was unprotected. And that's how they determine. They compare how much light causes a sunburn in protected skin versus unprotected skin. And that's how they determine the SPF. So one question I get a lot from my patients is SPF 100 better than SPF 30? What do you think? Yeah, okay, so the answer is yes, it is technically better, but not by very much. Okay, so I have this little chart here that shows how much percent of the radiation is blocked. So if you have an SPF 10, it blocks 90% of radiation. SPF 15 blocks a little more, 92.5%. SPF 20 blocks 95%. So you're getting more blocked sunlight, but not a lot more. And then you see the difference between SPF 20 and 40 is 95% of the sunlight blocked versus 97.5% of sunlight blocked. So yes, it is better, but not that much better. So the American Academy of Dermatology recommends SPF 30. And SPF 30 is adequate. Now, if you've had a lot of skin cancer, it may be beneficial to you to use a little higher SPF, but just know that if you go higher, it gets thicker and leaves more of a white film on your skin. So some patients don't like that trade-off so much. So as far as how to select a sunscreen, I always tell my patients the best sunscreen is one that you're actually going to use over and over again. So I'll have patients that say, well, I don't like the way the sunscreen feels on my skin, it feels too greasy. Well, that sunscreen is not going to serve you well because you're probably not going to use it. I have other patients that say, well, I like the spray because it's fast and easy. Okay, go ahead and use it then. So I put on here that creams are best for dry skin and face. Sticks are good to use around the eyes. So sunscreen stick, it looks like a little deodorant stick, but it's sunscreen. And then you don't have to rub it in because you just kind of apply it as a stick around the eyes. I do caution my patients who like the spray sunscreens because it isn't determined yet whether or not it's safe to inhale the spray sunscreen. So if you are going to use a spray sunscreen, you want to do it in a well-ventilated area. And I avoid using sprays on my kids because they don't know not to breathe it in. So we want to select a sunscreen that's broad spectrum, meaning protects against UVA and UVB, SPF 30 or greater, and has water resistance. And I will tell you, almost every sunscreen you get on the shelf in the drugstore is going to meet that criteria nowadays because all the manufacturers want to be compliant with the AAD guidelines. I also put in here that sunscreen is not the only way to protect your skin. So just common sense, we can use clothes that have sleeves, we can wear a hat with a brim. I wear sunglasses when I'm out in the sun because that protects my eyes and my skin around my eyes where it's harder to put the creams. And then seeking shade is another strategy. So if you're out watching a soccer game, you can, be under an umbrella or a tent. So I don't expect that we're all going to be lathering sunscreen all over all the time, but just sort of using common sense, seek shade, wear sun protective clothing, use a hat, use sunglasses, and just doing our best. So this is a poster from the American Academy of Dermatology, which has all the things we talked about. 1 in 5 Americans will develop skin cancer. We want sunscreen SPF 30, broad spectrum, water resistant. So on the sunscreen, it will tell you whether it's water resistant for 40 or 80 minutes. So if you're gonna be swimming, you wanna choose a sunscreen that is water resistant for 80 minutes, or if you're gonna be swimming or sweating. And then 1 ounce of sunscreen, meaning enough to fill a shot glass, is what they've determined to be the amount needed to cover the exposed areas of the body. This just shows how the different kinds of sunscreens work to reflect and scatter versus absorb and neutralize the sun's rays. I just put this slide in here to reiterate that on cloudy days, the harmful UV rays can penetrate your skin, and that snow and sand increase the need for sunscreen because snow reflects about 80% of UV rays and sand reflects about 25% of UV rays. So not to forget your sunscreen when you're in these climates. We want to make sure to apply our sunscreen 15 minutes before going outdoors so it has a chance to absorb. If you forgot to do it 15 minutes before, don't throw in the towel, still put it on. And then also protect your lips. I've had a lot of patients over the years that have skin cancer and pre-cancer on the mucosal part of the lip. When I put my sunscreen on, I will actually carry it over onto my lips and just rub it in my whole face and lips. And then reapply every 2 hours or after swimming or sweating heavily. Did anybody see the news a while ago about the sunscreen ingredients? No? Okay, some of us did. So I just put this slide in here in case it came up. The sunscreen ingredients are being studied right now by the FDA to determine if they're safe to be absorbed, because anything you put on your skin gets absorbed into your skin to some degree. So there hasn't been anything harmful found, but they are doing studies to determine how safe it is to absorb the sunscreen through your skin. So I don't put this in here to discourage anyone from using sunscreen, only to just say that we want to use common sense. We want to use sunscreen as part of a whole sun protection strategy of clothing, seeking shade. This is a question I get often, is will using sunscreen limit my levels of vitamin D? Because you may have heard that vitamin D lets your own body naturally, ultraviolet light lets your own body naturally produce vitamin D. So the answer is yes. If you stay out of the sun and use sunscreen, you will have less vitamin D. And so that is something the tanning salon industry likes to use to convince clients to go and get a tanning salon membership. But the AAD, American Academy of Dermatology, still maintains that adequate vitamin D should be from supplements and and foods that we get in our diet, as opposed to getting harmful ultraviolet radiation on our skin. So this is just a slide that says we can get vitamin D from supplements or foods. So the foods that have vitamin D are fish oils, fortified milk and yogurt, egg yolks, cheese, beef or calf liver, and mushrooms exposed to UV light. This is my second to last slide, and Dr. Lawton wanted me to touch on this topic, which is how to treat skin cancer. And the main thing I want to say is that most skin cancer is curable if we find it and treat it early. Who here has heard of Mohs surgery? Good. Okay, so that's what I specialize in, is Mohs surgery. Mohs has a funny name because it's named after a person. But Mohs surgery has the highest cure rate for skin cancers on the head and neck, and that's why we use it to cure a skin cancer if it's on the nose or the lip or in one of those sensitive areas where we don't have a lot of loose skin to work with. And the idea behind Mohs surgery is that we cut out the cancer and we test it in the lab while you're waiting. So it's like cut a layer, test it, cut again, test again, and kind of keep going until it's all out. And that way we can take as little as possible and try to preserve as much normal tissue as possible while removing predominantly the cancerous tissue. And I put this in here that treatment for advanced melanoma has changed dramatically. So maybe 20 years ago, melanoma may have been a death sentence if it was metastatic, but that is not the case anymore. So I have many patients that are living and managing with metastatic melanoma now that we have what's called targeted therapy and immunotherapy. So targeted therapy actually targets specific gene mutations in the melanoma cancer and can really shrink and reduce melanomas very quickly. Immunotherapy stimulates your own body's immune system to fight off the melanoma and has really revolutionized melanoma treatment. Revolutionized melanoma treatment. Sorry for the tongue twister. So in conclusion, exposure to UV light is the most preventable risk factor for skin cancer. Remember the ABCDEs of melanoma. Do regular self-skin exams. Choose a sunscreen that is SPF 30 or greater. And when in doubt, ask your doctor. And I'll open it up to questions. Okay, the question is, can warts be cancerous? And a true wart, a verruca, a viral wart, is not a cancer and is not cancerous. But the virus that causes warts, human papillomavirus, can cause precancerous spots that can evolve into skin cancer. But if it's just a common wart, like a plantar's wart, or the plantar means like on the bottom of your foot. Thanks for asking. So if it's just a common wart, it's not a skin cancer. But if it's like if someone has a spot that is not going away and just looks abnormal, I will do a biopsy if I'm in doubt. Okay, that's a great question. Sunscreen for small children. So sunscreen is not recommended for babies. We will usually just recommend shade and sun protective clothing, using a hat. For older kids, like 2 years old and up, I would start using a zinc oxide or titanium dioxide sunscreen. So those are like the old ingredients that used to leave like a white film on your nose. Now they're a little more sheer, so they're not as thick as they used to be. And you'll see that most sunscreens labeled as baby sunscreens will have those active ingredients, zinc oxide and titanium dioxide, and those two ingredients are determined to be generally recognized as safe by the FDA. And that goes back to that FDA study in the news that I mentioned. Zinc oxide and titanium dioxide are thought to be the safest at this time. So the question is, should we go to a dermatologist once a year or once every 5 years? For my patients who've had skin cancer, I will usually see them every 3 to 6 months. For patients who have a lot of moles that need to be checked, once a year would be great. Or if someone has a remote history of skin cancer, once a year would be great. So it varies by patient, but you should have your skin checked either by a dermatologist or by your primary doctor once a year, and then you should be doing your own self skin exams periodically, just like women are supposed to do their own self breast exams. You just want to make your skin exam just part of your regular routine. And if you see anything new or changing, or feel any new lumps or bumps, you want to bring it to the attention of your doctor. So the question is, what are the benefits of SPF clothing? So you may be seeing more and more clothing and hats and fabrics out there that have something on them called UPF. And UPF is a lot like SPF, and it has to do with how tightly woven the fabric is. So the more tightly woven it is, the less sun that will penetrate it. So what was the question? How effective is it? It's as effective as it says. So UPF 50 would be like SPF 50. But the more you wash the fabric, the less UPF it's going to have, because it's not going to be as tightly woven over time. So UPF is great. I mean, especially if you've had a lot of skin cancer and you want to be extremely vigilant, although I don't think that you need to go spend a lot of money on UPF clothing or be overzealous with it, because even on my kids, I'm comfortable with just regular clothes that have sleeves if they're at the park or something. So if it's, you don't need to invest too much in UPF clothing. I think that's great advice, to ask your doctor to screen you for skin cancer. At St. Joseph's, we have a couple of primary doctors in the building that just make that part of their routine annual wellness check. So I have Dr. Rosen, Dr. Nichols will send me a lot of skin cancer patients that they just catch on their routine annual physical. So, but if your doctor is not doing that, it's absolutely reasonable to ask, hey, can you look at my back? I can't see my own back. Or especially if you feel something new or you're worried about something as well, have them check your skin.